Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. Lung cancer is the #1 cancer killer of men and women in the U.S. And for over 100 years, the American Lung Association has led the fight for healthy lungs and healthy air. Today, the fight is more important than ever. And my next guests are Katie Halverson. She's the manager of tobacco control and lung health at the American Lung Association in Wisconsin, and Monique Hughes, who is the special events manager. Good morning, ladies.
Hello.
Thank you both for being here. And there is a lot going on with the American Lung Association in Wisconsin. And let's start off talking about some of the programs and services that exist for people out there who are concerned with their health.
Absolutely. We have a number of programs for patients with lung disease. Coming up in April, we have our Lung Force Expo in Brookfield, and that's an opportunity for patients and their caregivers with lung disease to come and learn about managing the disease and treating it, as well as for healthcare professionals to attend and learn about some of the latest research and innovations in lung disease. We also do a week-long asthma camp, a day camp for children with asthma in Milwaukee during the summer, and then we have a variety of programs where we go out and teach teachers or public health professionals how to implement programs in their community and help people with asthma, lung cancer, COPD, or that are trying to quit smoking.
Good stuff there. And many people will remember the tagline, and you ladies may be too young, but when you can't breathe, nothing else matters. And that's just one that really, if you come up with a million taglines, that one sticks out and really says it all. And the American Lung Association not only educates the public on how to quit smoking, you also advocate to make sure policymakers pay attention to the issues that affect lung health, right?
Absolutely. We do a lot of work with educating our legislators and, educating constituents to talk to their legislators about those important issues and making those policy changes in order to help support the lung health, because really, when you can't breathe, nothing else matters.
That's the truth. And Monique, you are the special events manager, as I mentioned, and coming up on March 19th, you've got the Fight for Air Climb, and this is something that happens every year, and each year it continues to grow. Tell us more about it.
Yeah, so the Fight for Air Climb is the vertical stair climb at the U.S. Bank Center downtown in Milwaukee. It's actually the #1 climb in the nation. We have over 3,000 people that participate, and we also, last year we fundraised over $730,000.
Wow.
So it's a really, really cool tagline that we can say here in Milwaukee, and I really think the community just really gets behind this event.
Yeah, and it happens at the U.S. Bank Center, and if people are not in shape, they've got a little bit of time to get their lungs together, because they actually are climbing the stairs of the Bank Center.
Yes, they're climbing the stairs, but they're not climbing down. They go down the elevator down. It's 1,034 steps and 47 floors, but it sounds like a lot, but we have climbers ages 7 to 85 that do it.
Wow.
And it really is, it can only be a race if you want it to be. So you don't have to feel the pressure to
kind of take your time. If you want to stop in between floors, you can do that.
Yes, there are water floors too. You'll have water, plenty of ways to hydrate and relax. And we wanted you to make it your climb, and whatever you're climbing for, whether it's because someone is affected by lung disease in your family, or if it is like a physical challenge, whatever it is, we want to help you make the most out of your climb.
And I think what's the most amazing to see is how you have firefighters who actually get involved every year, put on all of their equipment from head to toe, and climb those stairs.
Yes, we have quite the amount of firefighters that participate. It's Anthem's Firefighter Challenge. And so they go in a separate stairwell just because of their gear. It can aggravate people with asthma or lung disease. But they come out every year in full gear, and they climb those stairs, and they're very competitive too. They have their own award ceremony as well for the fastest team.
Wow. And that's something that they do, with a fire and smoke, climb stairs if they need to, and all that equipment. So we know if anybody can do it, they can, and we thank them for their service. How does somebody get involved with this year's Climb for Air?
Yeah, so you can register online at fightforairclimb.org. It's $25 to participate right now, and then every participant also fundraises an additional $100, which all goes back to the American Lung Association and our mission. And we do have over 760,000 people affected by lung disease in Wisconsin, and you know that 89 cents on every dollar that you're fundraising will go back towards those mission-based programs like Katie was talking about.
That's a big deal. And again, the website is fightforairclimb.org, or they can call 1-800-LUNG-USA for information on anything that we talk about this morning. For more than 30 years, you've helped hundreds of thousands of people to quit smoking. And you've got the Freedom from Smoking program. And I'm guessing that that's one of the number one things that people may look to you for to help them kick the habit.
Yeah, absolutely. We have the Freedom from Smoking program has a number of different aspects to it. There's an online version where you can go through and kind of coach yourself through tips to quit smoking. You can call our lung helpline at 1-800-LUNG-USA for some of that phone support. Or then we've got Freedom from Smoking clinics, and we train facilitators around the area to hold a Freedom from Smoking clinic where it's actually a group that meets every week. And they set their quit date together, and they go through all of the tips and tricks and counseling and thought process of quitting to really help support those individuals. And we actually do have a grant right now from the Anthem Foundation. They support our special events, which go back to our mission, and then the Anthem Foundation also provided some support for some cessation programming in Milwaukee. So we're able to provide more of those Freedom from Smoking facilitator trainings and get more of those clinics up and running.
Good stuff. And there are a lot of trendy forms of smoking these days. We have a little bit of time, but there's these hookah lounges now. People are vaping, and then of course there's the e-cigarettes that have been around for a while. Is this a growing challenge for people like yourself who are trying to educate and keep people from smoking?
It is, yeah. There's a lot of misconceptions about e-cigarettes. One of the biggest things that people don't realize is that they're completely unregulated. The ingredients are not regulated by the FDA. They're not, the products themselves are not regulated by the FDA. So you never really know exactly what's going in there. There's no rules for their...
Is that the same for vaping and hookah?
Yep, for the e-cigarettes and vaping. Hookah, there are e-hookahs, vaping, e-hookahs, e-cigarettes, e-pipes. Those are all kind of the same thing, that electronic device. It's the electronic device that heats up some liquid nicotine or flavorings. There's also hookah, which is, it heats up a mixture of tobacco and flavorings with charcoal, and then that's goes through water before it's inhaled. So there's a lot of misconceptions about both. A lot of people believe hookah to be safer than cigarettes because it's filtered through the water, but really none of the toxins of the tobacco or flavorings or the charcoal smoke filter through the water. So it just cools it down. And for e-cigarettes as well, there's just not enough research being done on them yet. We don't know what's in them or what's safe to inhale into your lungs.
Wow, and that is definitely something that people need to keep in mind, especially the college-age kids. It's really one of those things that's trendy. There's lounges, like I said, where that's where everything's happening. So people just need to do their research and make sure that they understand what it is that they're doing and how it can affect their health.
Yep, absolutely. There are a lot of people that are using e-cigarettes to try to quit. And it's not an FDA-approved device to quit. You know, we have those things like Freedom from Smoking and the nicotine patch and gum that are approved to help people quit. But really what we're mostly concerned about is people picking up e-cigarettes that don't smoke, that they're not switching to them. They've just never used a tobacco product, and now they're picking up e-cigarettes and really creating a lifelong addiction.
Wow.
So we want to try to help educate youth and young adults from starting to use those products.
All right. Well, we have run out of time, but I did want to mention in April, Monique, you got the Oxygen Ball Breathe at the Hyatt in downtown Milwaukee, and people can go to your website and get more details on that.
Yeah, that's a gala supporting the American Lung Association in our efforts on April 30th.
April 30th. Thank you, ladies, so much for coming by. Appreciate your time and all the great information. Katie Halverson is the manager, Tobacco Control and Lung Health, and Monique Hughes is the special events manager for the American Lung Association in Wisconsin. For more information, again, log on to lung.org or call 1-800-LUNG-USA. And that's going to do it for today's show. I'm your host, Andrea Williams. As always, I thank you for watching, and I hope you join us again next week as we take another look at our issues, Milwaukee. Have a great day.